Surgeon General has declared an epidemic of loneliness in the United States, and that loneliness, well, it can affect our health and even lead to premature death. To help us understand the implications of loneliness, we are joined by our medical expert, Dr. David Winter. Now, Dr. Winter, I want you to give us your thoughts on loneliness. What does this mean, and is it getting worse in our country?
Well, social interaction first is a mainstay of our health. In fact, some people argue that it's as important as food, water, even sleep. We do know that loneliness, in fact, has some very bad hazards. It can actually increase the chance of heart attacks, strokes, dementia, depression, even premature death. Now, back in the peak of COVID, we saw a big increase in loneliness in this country, but it hasn't slowed down. It's actually stayed the same and gone up a bit in some parts of the country. So we need to look at this because loneliness is not good for your health.
Yeah, very interesting to hear that things haven't changed even without having COVID around as much. I would assume that younger folks who use social media frequently are more subject to loneliness. Is that correct?
Yeah, that is true. In fact, we look back a couple decades, and if you look at children and their interaction with their peers, with other children, it's 70% less in some school systems, in some neighborhoods. So a lot less, and we think computers have a lot to do with that. Now, if you look though at middle-aged folks in the working environment, work stresses are higher, so less social interaction there. Of course, a lot of folks are looking at a computer all day long there in the workplace, and some are just working at home. And if you look at the older folks, they say they're more lonely because maybe they lost a spouse, they've retired, maybe their health isn't good. So a lot of reasons in different age groups for loneliness, but it's increased across the board in America.
Now, you mentioned that loneliness, it can cause some health issues. It makes sense, of course, that something like depression, right? You're by yourself, could occur when folks are lonely. But why do they also have medical issues and even premature death?
Yeah, you look at dementia. Our brains require stimulation to stay robust, to stay healthy, just like our muscles need to be exercised to stay strong. So if you're lonely, if you're not working that brain, that can increase the risk of dementia. We've actually seen atrophy in brains on CT scans, MRI scans of folks. So that's a problem. And then also we know that cortisol levels, adrenaline levels increase when you're lonely. That's not good for you. Those things can increase blood pressure, cause you to put on weight. They can increase the chance of diabetes, heart attacks, strokes. So a lot of things can go wrong right now. We need to talk about loneliness and how we can prevent that.
So there's something chemically happening inside of us when all of this is taking place, when we refer to loneliness. What can be done to combat this, and what do experts recommend?
Yeah, here's a couple of things we recommend. First, maintain and strengthen your current relationships. Hang out more with your friends, with your loved ones. That's helpful for you. You might want to volunteer, give something back to the community. That's a good way to network with like-minded people, people thinking the same as you, and you might even get a new passion to energize you. Find a support group if you need one. There you can identify folks who can really appreciate what you're going through. Good way to make close relationships and support groups. A new hobby can stimulate your brain, the opposite of loneliness. Maybe take up a foreign language, learn how to play the piano, guitar. Pets are fun. Dogs in particular are great for comfort, great for companionship. I actually enjoy teaching a dog new tricks, and of course dogs get you out walking them once a day, so that increases the exercise. A lot of ways to combat loneliness, but the first thing is you have to recognize it. Second, admit that it may be you may have a touch of loneliness, and do something about it. Very important for your long-term health.
Oh my goodness, very good information, Dr. Winter. Always so great to have you on. Thank you so much for joining us this morning.
Thank you, Tashar. Good to be